While preparing for a joint replacement, there are often questions and concerns that arise. Our goal is that this class will help answer these questions and prepare you for your surgery. As you view this presentation, please follow along in your Guide to Total Joint Replacement booklet. Having a joint replacement is a big decision. We want to make sure that your experience is an excellent one. As you prepare for surgery, please start with these homework assignments. First, it is very important to identify a support person who will be available to help at home after surgery. They will assist you with mobility and other personal needs that may arise. The support person should be available to assist you at home for the first week after surgery. They will also be needed for transportation assistance after, until your surgeon provides the okay to drive. If you have a pet, please consider pet care responsibilities as well. Another important step is to safety-proof your home. Remove all throw rugs, electrical cords in hallways, and any other objects that may increase the risk of a fall. Pathways in the home need to be clear of obstructions and wide enough to allow easy movement with a walker or crutches. Handrails will assist with stair climbing and should be installed prior to surgery if they are absent. Exercises to do in order to strengthen your muscles for surgery may be found in your booklet. Prior to your surgery, your surgeon will refer you to physical therapy for instruction in exercise, mobility with a walker including stairs, as well as safety in the shower and bathroom. When you come to the hospital for your surgery, bring your Guide to Joint Replacement booklet with you. If you have an advanced medical directive, such as a durable power of attorney, please bring this with you so a copy can be placed into the electronic medical record. Please bring an updated prescription medication list and also bring your medications in a clear plastic bag. The medications will be reviewed by the medical team. Your surgeon will be prescribing medications such as antibiotics and pain medication after the surgery. The pharmacy will verify that all medications can be safely taken together. During your stay, you may wear your own clothing. Pack loose-fitting, comfortable clothing such as sweats, athletic shorts, or lounge pants. Avoid shoes with open backs, such as sandals or slippers, as these can pose a tripping hazard. There may be some swelling in the leg and foot after surgery. Bring shoes that allow for this. If you have a front-wheeled walker, please bring this to the hospital. You may leave it in your vehicle as it won't be necessary until after surgery. Also, bring along any personal hygiene items that you wish to have during your stay. Call the hospital as noted on page 4 in the booklet for your arrival time. Some patients will be discharged home the day of surgery, and transportation home should be arranged for the afternoon or early evening. Many patients will spend one night in the hospital postoperatively, and discharge will likely occur around 11 a.m. the following day. Please have your ride available to pick you up at 11 a.m. In your booklet, you will find detailed instructions on preoperative skin preparation. You must wash with an antibacterial soap called chlorhexidine gluconate, or CHG. This will be given to you by your surgeon's office for daily washing starting 3 days prior to surgery. Do not shave the surgical area within 72 hours of surgery, as this can increase infection risk. Please do not drink alcohol for 24 hours prior to surgery. Per anesthesia safety protocols, there should be no food in the stomach at the time of surgery. Do not eat anything, including gum or throat lozenges, after midnight the night before your procedure. You may drink clear liquids up to 2 hours before you arrive at the hospital. Gatorade, pre-surgical Ensure, or white grape juice are good options. Remember, coffee creamer and orange juice are not clear liquids. You may brush your teeth, but be sure not to swallow anything. The morning of surgery, use the antibacterial wash as instructed. When you arrive at the hospital, please enter through the main entrance. You will be greeted at the desk and will be directed to the surgical services area. Nurses will complete your check-in, and anesthesia personnel will meet with you to discuss your plan for anesthesia. You will be given a 4-digit PIN number when you check in. Due to HIPAA privacy laws, we are unable to give any of your health information over the phone to family or friends unless they provide the PIN number. Once you arrive to your room after surgery, you will be able to order food. It is often an hour or hour and a half in the recovery room after surgery before you will be brought to your room. You will be up and moving as soon as possible after the surgery, usually within a few hours. For safety, you will ambulate with a gait belt and a hospital staff member. This means you may not move around your room without assistance from hospital staff at any point during your stay. Please call before you get up for any reason. All patients will be seen by physical therapy prior to leaving the hospital. You will be instructed on how to safely use the walker and will be given some exercises to do at home. Some of the criteria for discharge include the ability to walk greater than 50 feet, sitting and standing with minimal assistance, and pain that is controlled with oral medication. You will also need to be able to tolerate food and be able to urinate prior to discharge. There are other items and equipment that you will likely encounter during your hospital stay. All patients will have an IV placed for intravenous fluids and surgery and medications such as antibiotics. Most patients will also receive TED stockings, which provide compression to the legs to help reduce swelling. These stockings may be knee-high or thigh-high and will likely be put on in the recovery room. They will be worn throughout the hospital stay, and you will be given instructions on using the stockings at home per your surgeon's guidelines. Some patients will have a urinary catheter. If a catheter is utilized, it will likely be placed in the operating room and left in place until the morning after surgery, at which time it will likely be removed. Some patients may have unexpected difficulty urinating after surgery. A catheter may also be utilized if this occurs. Compression boots or sleeves are also utilized to decrease the risk of a blood clot. These devices with Velcro straps go around the lower legs or feet and are hooked up to a machine that fills them with air intermittently. This provides a massaging effect that promotes blood flow in the veins. Some patients may have a surgical drain placed in the hip or knee in the operating room. This is a small tube that will likely be left in place for a day after surgery. You will also be provided with an incentive spirometer, which is a device that encourages deep breathing to ensure that air gets into the bases of the lungs. You will be instructed in the use of this tool and encouraged to use this frequently during the hospital stay and for several days at home. Use of the spirometer will help decrease the risk of postoperative fever or pneumonia. If you have a hip replacement, you may have a foam wedge abduction pillow placed between your legs after surgery to reduce the risk of dislocation. The wedge will be removed when you get up with physical therapy or with the nurse. If you spend the night in the hospital after surgery, expect your first postoperative day to start early. The day typically starts at 7 a.m. and surgeons round early. Physical and occupational therapy will start early as well. You will sit in the bedside chair to eat, wash up, and get dressed. Catheters and drains are typically removed first thing in the morning. Medications are usually administered early in the morning as well. We recommend that your support person be present during the therapy sessions. If you feel that you are not tolerating your medication well, or if you feel your pain medicine isn't working, please let your nurse know. Some patients will experience postoperative nausea. You may be given medications to alleviate these symptoms. Pain is an expected part of your postoperative course. Our goal is to keep pain at a tolerable level. This means a target of 4 or less on a 0 to 10 scale. A pain level of 0, meaning no pain, is ideal but often difficult to achieve. Again, pain medication can be modified as necessary if it is not providing adequate pain relief, causing nausea, or other side effects. Narcotic pain medicines are frequently prescribed, but some patients are able to control their pain with over-the-counter medication such as Tylenol or ibuprofen. Ice and elevation are also helpful for pain control. Turning down the lights or utilizing distractions such as TV, music, or visitors can be helpful as well. If you undergo a total knee replacement, you may benefit from a cooling ice unit. If you have one from a prior surgery or have borrowed one from a friend, please bring that with you to the hospital. Most patients will have a Mepilex surgical dressing. This dressing is designed to stay in place until removed by your surgeon's office at your first postoperative visit. These dressings are water resistant but not waterproof. You may shower with the dressing on and simply pat it dry. You should avoid soaking in a tub with the dressing on. If your dressing comes off, call your surgeon's office during office hours. Constipation is a very common problem postoperatively. Pain medications and lack of mobility are notorious for causing constipation. It is important to have stool softeners like Senecot and mild laxatives like Miralax available at home. Make sure to include plenty of fiber in your diet, with the goal being 25 to 35 grams of fiber daily. Eating fruits, vegetables, legumes, and whole grains can increase your fiber intake. Fiber supplements are also available over the counter. 6 to 8 glasses of non-carbonated fluids per day is also recommended to help maintain healthy bowel habits. Caffeine should be avoided as it is a mild diuretic and can cause fluid to shift out of the bowels to the kidneys, leading to harder stools. You can refer to your booklet for additional suggestions to assist with reducing constipation. Having a joint replacement is a big decision, and with proper preparation, it can be a very rewarding experience. Initially, your recovery can be challenging. Each day after surgery gets a little easier, so it is important to stay focused and work hard. It is common to feel fatigued after surgery, and rest is important. Short naps can be helpful. If you have a total knee replacement, outpatient physical therapy will be ordered. It is imperative to regain range of motion as soon as possible after a knee replacement, and regular physical therapy visits will help achieve this goal. There may be some discomfort associated with physical therapy. Timing your pain medications to be taken prior to therapy can be helpful. Icing afterwards can reduce pain and swelling. Some patients may also be eligible for in-home physical therapy, and this can be arranged prior to discharge if necessary. Some patients will experience post-surgery blues. Planning activities and having visitors can help alleviate this problem. Please take your time to read through the following and final screen on this presentation to familiarize yourself with what is normal and expected after surgery. It's important to know the reasons to call your surgeon and what is an emergency situation necessitating a call to 911 or a trip to the emergency room. If you have any questions or concerns once you are home, please call your surgeon's office during business hours.
Hi, my name is Alyssa, and I'm an occupational therapist here at MyMichigan Health.
And my name is Kim, and I'm one of the physical therapist assistant here at MyMichigan Health. Physical therapy will educate and address your bed mobility, walking, strengthening, range of motion, and any equipment needs that you may have at home, including a two-wheeled walker. If you have hip precautions, you will not be allowed to bend past 90 degrees, no twisting on that hip joint, and no crossing your legs. Knees, no twisting at the knee joint.
Pre-op and post-op exercises. The following exercises can be completed while lying in bed or in a chair. Ankle pumps. Bend the ankles going up and down 10 times. Then make circles going in clockwise direction 10 times and counterclockwise 10 times. Glute sets. Squeeze both buttock muscles together as tightly as possible and hold for 5 seconds. Do 20 times. Quad sets. Use the front muscle of your thigh to press up the back of your knee against the bed. With toes up, straighten the knee on your surgical leg as much as possible. Hold it for 5 seconds. Do 20 times. Short arc quads. Place towel roll or coffee can under the knee on your surgical leg. Keep your knee on the roll, point toes up, and try to straighten it by lifting your foot towards the ceiling, and hold it for 5 seconds. Then slowly return to starting position. Do 20 times. Heel slides. Gently bend knee on surgical leg by sliding the heel up towards your buttocks, keeping the heel on the bed. Don't let your knee fall in or out. Keep it straight. Make sure you do not bend your hip more than 90 degrees if you have hip precautions. Hold this exercise for 20 to 30 seconds and then slowly return down to straighten out the knee. Do 20 times. Abduction. Hips only. Keeping your surgical leg straight, slowly move it out to the side. Carefully return it to the starting position, being careful not to cross the midline. Do not turn toes in or out. Keep up and straight. Do 20 times. Do not do this exercise if you have anterior lateral precautions following surgery. Straight leg raises. Knees only. Slightly bend your non-surgical knee and place that foot flat on the bed. Lift the surgical leg up towards the ceiling approximately 8 to 10 inches, holding for 3 to 5 seconds and keeping the knee as straight as possible, and slowly return it down to a flat position. Do 10 times. Seated knee flexion, knees only. While sitting in a straight back chair, bend your surgical knee underneath the chair as far as possible. Hold the stretch for 30 to 60 seconds, remembering not to force the knee. Slowly return to starting position. Do 10 times. Long arc quad, hips and knees. Sitting in a chair with your knee in a bent position, slowly straighten your knee as you raise your foot upwards. Hold for 3 to 5 seconds and slowly lower back down towards starting position. Do 20 times each leg. Using your two-wheeled walker. Move the walker forward. With all 4 walker legs firmly on the ground, step forward with the surgical leg. Place the foot in the middle area of the walker. Do not move it past the front feet of the walker. Step forward with the non-surgical leg. Take small steps. Your doctor and physical therapist will instruct you in your proper weight-bearing status. Do not carry items in your hands while using your walker. Your hands must be directly on the walker handles. Getting into bed. Back up to the bed until you feel it on the back of your legs. You need to be midway between the foot and the head of the bed. Reaching back with both hands, sit down on the edge of the bed, extending your surgical leg. And then scoot as far back towards the center of the mattress as you can. Move your walker out of the way, but keep it within reach. Scoot your hips around so that you are facing the foot of the bed. Lift your leg onto the bed while scooting. Keep scooting and lift your other leg onto the bed. Scoot your hips towards the center of the bed. Getting out of bed. Sit up, scoot your hips to the edge of the bed, while lowering your surgical leg to the floor and then the other leg onto the floor. Scoot to the edge of the bed. Grabbing your walker to put in front of you, use both hands to push off the bed. Balance yourself before grabbing the walker.
Going up and down the stairs. It is recommended that you have at least one handrail installed prior to your surgery date. To go up the stairs, lead with your non-surgical leg, followed by your surgical leg. Non-surgical leg, surgical leg. To go down the stairs, lead with your surgical leg, followed by your non-surgical leg, surgical leg, non-surgical leg.
Occupational therapy will address your ability to perform self-care tasks following surgery, including equipment needs for your bathroom and dressing, bathing, and toileting, transferring in and out of your vehicle, shower, and toilet. Some things to keep in mind and prepare for at home prior to your surgery includes adequate lighting, especially night lights within your bathroom, bedroom, and kitchen. It is also very important to make items accessible. This includes keeping frequently used items within easy reach, especially in the kitchen, bathroom, and bedroom. And finally, laundry and cleaning. Make sure you have a few weeks of clean clothing available, as you will not be able to carry a laundry basket while using your walker. Equipment that the occupational therapist will address with you includes, in the bathroom, a shower chair, a toilet riser, or commode. The occupational therapist will also address your ability to get dressed. If you are a patient with hip precautions, you will be given the following equipment: sock aid, shoehorn, reacher, and long-handled sponge. The occupational therapist will go over this equipment with you in regards to the proper use, and you will have the ability to practice using this equipment prior to going home. The following slide is a visual of all the equipment that you may need for home, including the shower chair, a tub transfer bench, a toilet safety frame, toilet riser, bedside commode, and finally, the dressing equipment.
Getting into the tub. Shower chairs, grab bars, and handheld shower heads make bathing easier and safer. Use a rubber mat or non-skid adhesive on the bottom of the shower or tub. First, place the shower chair in the tub facing the faucets. Back up to the tub until you can feel it at the back of your knees. Be sure you are in front of the shower chair seat. Reach back with one hand for the shower chair. Keep the other hand gently on the walker. Slowly lower yourself onto the shower chair, keeping the surgical leg out in front. Move the walker out of the way, but keep it within reach. Turn and lift your legs into the tub. Do not cross your legs while doing this. Getting out of the tub. Turn and lift your legs over the outside of the tub without crossing legs. Scoot to the edge of the shower chair. Push up with one hand on the back of the shower chair while holding the walker gently with the other hand. Balance yourself before grabbing the walker. You will use the same technique for getting into and out of the vehicle using the front passenger seat. Getting onto the toilet. You will need a raised toilet seat or a 3-in-1 bedside commode over your toilet following surgery. Your occupational therapist will assist with this information. First, take small steps and turn until your back is to the toilet. Never pivot. Back up to the toilet until you feel it touch the back of your legs. Keep one hand on the walker while reaching back for the toilet seat with the other hand. Slide your surgical leg out in front of you before sitting down. When getting up from the toilet, place one hand on the walker, slide your surgical leg out in front of you, and push off the toilet seat with the other. Balance yourself before grabbing the walker.
Again, we are so glad that you've chosen Mid-Michigan Medical Center for your total joint replacement. We will work with you to best ensure that you have an excellent experience. Please let us know how we can best help to achieve that. Thank you for attending this virtual class. We look forward to seeing you on the day of your surgery.